The brain is just as active when we're awake and conscious as when we're dreaming, just in a different way. Dreaming is considered a cognitive function. During a dream, the brain internally produces stimuli during REM or rapid eye movement sleep, and our interpretation of those stimuli comes together to produce what we call a dream. This process is the same as what we do when we're awake. The only difference is that when we are sleeping, there are not any stimuli being interpreted from the outside world. Therefore, images we see in dreams are based on previously seen things that happen when we are awake. The emotions that are felt have also already been processed. The limbic-related projection area and the parahippocampal cortices are activated during a dream, which bring about emotional and memory processes. There are several different theories on why we dream. The uncertainty in this area shows that there is still so much that we don't know about dreaming. The first thought is that dreaming is an epiphenomenon, meaning that a dream is simply a byproduct of neurochemical transitions that occur while we sleep. By this definition, it is implied that dreams simply have no meaning and they are not very closely related to what happens when we are conscious. Another more in-depth reason for why we dream is that it is a product of evolution. Evolution is based on natural selection, meaning that dreaming somehow aids in a species' survival. Possible reasons for dreams persisting throughout generations are threat stimulation, memory consolidation, memory dumping, and trauma processing. Dreams could possibly simulate dangerous situations in which it would be beneficial for us to practice how we would react so that when we are awake and in a similar situation, we have already had experience in the dream. Information that is necessary for survival is thought to be processed during REM sleep. Additionally, a lack of REM sleep weakens the ability to remember things from one day to the next. Another way that dreaming aids in memory is by memory dumping. Getting rid of unwanted or unnecessary memories happens during REM sleep. These events are thought to be diluted during a dream. In other words, they are interwoven with older memories so that they do not seem as vivid or recent. The last reason for the significance of dreams comes from a psychological point of view. Years ago, in the time of Sigmund Freud, psychologists began using them as a way to examine a patient. Although many people do not use this tactic anymore because of the lack of information that we have on dreams, there is still belief that they have significant meaning. As Merced points out in the Journal of Mind and Behavior, dreaming may be studied as an empirical, meaningful cognitive phenomenon. As mentioned before, brain stimulation from the outside is absent, so everything that makes up a dream comes from the person's inner self. While image selection likely assumes a probabilistic nature, the process is based both on the activation of memories and the use of figurative thinking. This suggests that a person's dreams can be clarified and connected in order to find meaning. A topic that is a little more certain than why we dream is when we dream. Dreaming occurs 4 to 5 times a night at 90-minute intervals. Each dream lasts for 10 to 40 minutes, and the last dream is the longest. Studies conducted in the 50s and 60s showed that when subjects were awakened during and after REM sleep, dreams were reported 74% to 95% of the time. Although, contrary to popular belief, dreaming does not always occur in REM sleep. It also occurs in non-REM sleep, mostly being reported within 15 minutes of REM sleep. This could possibly be due to the brain transitioning from REM to non-REM sleep, where there is less brain activity.
The two distinct types of sleep, REM and non-REM, are characterized by the brain waves that are associated with each and the physical characteristics which change. REM sleep is a mixture of low-amplitude mixed-frequency brain waves, which are similar to those experienced during the waking state. Activated by acetylcholine, a small group of cells in the brainstem called the subceruleus nucleus controls REM sleep. Rapid breathing, increased blood pressure, and muscle paralysis are symptoms usually experienced during REM sleep as well. It's known as paradoxical sleep because of the brain's oxygen consumption, reflecting its energy consumption, is very high during this period and often higher than when awake. In contrast, the waves that characterize non-REM sleep take up most of the sleeping that we do. The ventrolateral preoptic nucleus in the hypothalamus and the parafacial zone in the brainstem prompts non-REM sleep. When these cells turn on, they trigger a loss of consciousness. Non-REM sleep consists of large, slow brain waves with relaxed muscles and deep breathing. This helps the brain and body regenerate and relax after a long day.
Why do we remember some dreams and not others? You dream 4 to 6 times every night and will have around 1,800 dreams this year. About 90 to 95% of them will instantly disappear from your memory. When people are awakened during times of REM sleep, they have a higher percentage of dream recall. And when people are awakened during other times throughout the night, there is a lower percentage of dream recall. In an early study, subjects were asked to recall dreams when woken up in REM sleep versus in non-REM sleep. The results showed that of the subjects who were awakened during REM sleep, 152 recalled dreams and 39 did not. Of the subjects who were awakened during non-REM sleep, only 11 recalled dreams and 149 did not. REM dreams are recalled at a much higher rate than non-REM dreams, likely due to the fact that the brain is much more active in REM sleep. REM sleep is characteristically different from non-REM sleep in that the brain activation patterns are more closely related to the brain activation when we are awake. When in REM sleep, some parts of the limbic system are activated, causing the dreams to be more emotional, motivational, and longer. They were also more likely to contain social interactions within the dream. REM dreams were more memorable, vivid, and dynamic. In the small chance that a non-REM dream is recalled, it is usually less vivid and the dream itself is more conceptual, more plausible, and shorter in duration. This is because during non-REM sleep, the brain is conserving energy and facilitating memory consolidation, making the brain much less active. Many other factors have been proven to play a smaller role in dream recall frequency. These factors can be separated into two groups: state factors and trait factors. Examples of state factors include sleep duration, nocturnal awakenings, distracting events in the morning, and emotional stress. Stress, no matter the reason, can have negative effects on dream recall. For some people, stress causes nightmares or anxiety dreams, while for others, it causes dreams to slip out of consciousness immediately upon waking. Trait factors deals with personality measures including introversion and extroversion, anxiety, and cognitive abilities. People who are more introspective, more introverted, and prefer divergent thinking, more creative, and have pronounced visual imagery recall more dreams. People who like dreaming, give dreaming a meaning, think them over, and tell them to other people also recall more dreams. Although most dreams might vanish, many people can remember certain dreams. Do you have any specific dreams that you can always remember? This is because these dreams were so beautiful, bizarre, or scary that they captured your attention and increased the activity in your dorsolateral prefrontal cortex, a brain region that facilitates memory. So, the more impressive or elaborate your dream, the more likely you are to remember it.
Did you know that there are different types of dreams? Think about a dream that you do remember. What was actually your role in that dream? Did the dream seem to just happen to you, or were you able to influence your actions within the dream? Did the elements of the dream seem normal until you woke up and realized how bizarre they are in the context of your everyday reality? Non-lucid dreams are what most of us experience on any given night. They are characterized by the fact that the dreamer doesn't know they're dreaming. You're not thinking, "I'm dreaming right now. This isn't real." This lack of insight is the most important aspect distinguishing a non-lucid dream. Further, these types of dreams are characterized by restriction to the immediate scene of the dream. Your persona in the dream isn't capable of planning what they'll do next or of controlling their behavior. What happens, just happens. In contrast is a second type of dream, lucid dreaming. Lucidity is defined primarily by the fact that in the dream, the person is aware that they're dreaming. If you think about it, this is a remarkable insight for your brain to process while you're asleep. The benefit of having this insight is that you can take advantage of self-reflection and volition within the context of the dream. You are able to control your character and their interactions with the dream environment. The lessons that we can learn about consciousness by studying dreaming relate closely to the distinction between primary and secondary consciousness. Psychologists have defined two distinct categories of consciousness. The first is primary consciousness, the ability to perceive sensory information and integrate it into awareness, but that awareness is confined to the present moment. Primary consciousness is associated with non-lucid dreaming. The next category is secondary consciousness. When you are secondarily conscious, you have awareness of your surroundings. This metacognition enables us to have self-reflection and willful intention. It incorporates the past and the future as well. You have access to memories, and you are also able to plan for future actions. Secondary consciousness is more closely associated with lucid dreaming. So, are you conscious when you're dreaming? One study by leading dream researcher Ursula Voss investigated this question, seeking to find out how consciousness changes between being awake, lucid dreaming, and non-lucid dreaming. The study also aimed to find the brain activity that correlates with shifts between these states. The study started by training undergraduates to become lucid. Subjects were also trained to make a specific eye movement pattern when they drop into a lucid state. Because the researchers were able to track eye movements, they could detect this pattern and confirm that the participant was in fact lucid dreaming at the time, as seen in the graphic. Observations were made in a sleep lab and divided into 3 categories: awake with eyes closed, non-lucid REM sleep, and lucid dreaming. Eye movement was recorded and brain activity was also recorded using an EEG. Then these recordings were compared based on the 3 categories, as well as by brain region, to try to understand the changes in neural activity that coincide with the changes in state. The EEG measures from this study found that lucid dreaming can best be distinguished from the other 2 categories by an increase in high-frequency 40 Hz bands, especially in the frontal region of the brain. Frontal lobe activity likely causes the self-reflection that is present during lucid dreaming. This makes sense because we know that the frontal lobe is important to executive functioning and decision-making. Results indicate that the 40 Hz waves play a functional role in the modulation of conscious awareness across states. Overall, scans showed that lucid dreaming is also closely correlated with a large increase in global neural networking.
Though there is no firm consensus on whether lucid dreaming relates directly to being conscious, the previous study and many others have labeled lucid dreaming as a hybrid state of consciousness. Lucid dreaming has brain activity that is distinct from both waking and from non-lucid REM sleep. Overall coherence levels were similar in waking and lucid dreaming and significantly higher than in REM sleep throughout the entire frequency spectrum analyzed. In lucid dreaming, coherence is strongest in frontolateral and frontal areas. These observations led to the hypothesis that lucidity arises when frontal lobe activation associated with being awake interacts with posterior structural activation associated from REM sleep. It's like half your brain is awake, half is asleep, hence the term hybrid state of consciousness. Though we may never understand all the complexities of consciousness, studying dreaming has given us some important insight. Our brains are just as active when we are dreaming as when we are awake, but in a different way. This shows that consciousness is not defined by how active the brain is, but rather by where the activity of the brain is concentrated. When the activity occurs in areas that facilitate perception and self-awareness, then you are considered to be conscious.